Hi, my name is Molly Bradshaw, member that's in charge of NSC 900, which is DNP role development. So I wanted to do a quick video series to kind of help you get focused and oriented about what the course is about and what we'll be doing. So I'd sent out an email previously that there is a clinical component. So I wanted to kind of clarify what that means, because in the DNP program, we happen to refer to our experience within an organization as a clinical, but it's different than clinicals you may be used to. Like here, I'm seeing patients today. We're not going to be doing things like that in clinical for the DNP program, but I want to kind of give you a little background, a little review, so that you can be thinking about this and kind of know what to expect. So first thing we need to talk about is what's called the DNP, the American Association of Colleges of Nursing, set out a list of essential skills that they feel that every DNP prepared nurse should be able to speak to. So I sent you this list. This is a full document online that I want you to read and be familiar with. But short and quickly, these essentials are: we want DNP nurses to use scientific underpinnings for practice, to think about organization and systems, quality, leadership. We want to think about information and system technology to improve healthcare outcomes, focus on population health, and be experts of whatever our role in nursing is. So these skills are the types of things that we want to develop in you in this DNP program. EKU's DNP program focuses on leadership within an organization, organizational leadership. So when we talk about clinical or clinical hours, we're talking about how we're using this opportunity to develop these DNP essential skills. So another important thing to know is that the American Association of Colleges of Nursing also says that a person with a DNP degree should be able to document at least 1,000 clinical hours beyond a bachelor's degree to develop these skills. So what we do here at EKU, when you apply to our program, we do what we call a gap analysis, and we look at your master's degree and how many clinical hours were in your master's degree, and we do sort of an individual assessment about how many hours we need to document so that we can show that you have this 1,000 hours of clinical practice beyond your master's degree, or beyond your bachelor's degree. So most of the clinical hours or experience hours that you're going to be doing at EKU have to do with the work of doing your DNP project. But there will also be a few clinical hours or experience hours that we associate with this course, where we will be talking about how do we push you to a new level? How do we take you from being a master's prepared nurse to a DNP prepared nurse? So the way this class works is 1 credit hour is worth 60 clinical hours. During these clinical hours, you do not have to see patients. You don't have to go do the health assessment, none of that kind of stuff. We are focusing on what are the things that we could do individually for you to either help you move along the work of your DNP project, learn more about how healthcare systems and healthcare organizations operate, develop your own DNP skills. So what we will be doing is, first you will talk to me about an organization in which you would like to go do your hours. So most of the time, this is the organization which is going to be your partner for your DNP project. Most of the time, people are employees of these organizations, but you don't have to be. If you're going to do your DNP project with the local health department at your local church, there's lots of different ways you can get involved with organizations. Maybe it's a professional organization like AACN or something like that. But you're going to partner with an organization who is passionate about the same healthcare problem that you're passionate about. You're going to talk to me about that, and we're going to talk through just quickly what kind of goals we want to set for you, because these are individualized learning objectives for you. You're also going to identify a preceptor in the organization. I will send you a packet for you to give to your preceptor so that they will know what to do and what to expect and things like that. But the preceptor is someone in the organization that you're going to kind of work with to learn more about the organization, how things work. Ideally, this is not somebody like your boss or somebody, that you're with constantly. This might be somebody who's in the C-suite. Maybe you're going to spend time with the CFO, the Chief Financial Officer, maybe the CNO. Maybe you're going to go spend some time in IT and try to understand more about how the computer systems work. Maybe you need to go down to the pharmacy and spend some time learning how pharmacies work. Maybe you need to spend time in the community. We had a DNP student who spent time with an attorney in town who wanted to open up a health clinic in a local shopping center. So the world is kind of wide open here. And so that's why we need to have individual conversations about what your goals are, what kind of organizations you're going to be working with, and what kind of preceptor might best suit your learning needs. When you and I have kind of talked that out, we will get a clinical contract together. There's a form that you have to fill out. We have to get a clinical contract for you to be able to do this with the organization, because you will not be in that organization as an employee. You will be there as a student. So we need to make sure that paperwork is in order. There needs to be a contract there. You will work out some learning objectives between you and your preceptor, and then you will show them to me and I will approve them. So you will have from the beginning of the course in the fall to the end of courses in December to get these hours done, and we will talk to you. Some of you need to do more hours than others, depending on your gap analysis when you were admitted to the program. But again, these hours are what we call experience hours, practicum hours. It's not doing patient care, it's learning to develop your essentials. Now, there's one other document from the ANCC also, the white paper on clarifying recommendations for the DNP project. There's just a few things that I want to point out in that document. So on page 7, it says a practice immersion experience, which is what we're calling clinical hours here, affords an opportunity to apply, integrate, and synthesize the DNP essentials that are necessary to demonstrate achievement of the desired outcomes. We want you practicing at the highest level. In regard to your practice experiences, they should be designed, this is on page 8, they should be designed to help you achieve specific individualized learning goals. We want you to work on interprofessional collaboration. The DNP program practice experiences are designed to give systematic opportunities for feedback and reflection, do in-depth work with mentorship with experts in nursing as well as other disciplines. Your preceptor does not have to be a nurse. They do not have to be doctorally prepared. Maybe there's somebody else that you want to learn from and grow with. Opportunities for meaningful student engagement in practice environments. Opportunities for building knowledge at a high level of complexity. Opportunities for further application of synthesis and expansion of learning, experience in the context of advanced practice nursing in which the final DNP project is going to be completed, and really opportunities for integrating and synthesizing all of the DNP essential skills. So that is basically in a kind of nutshell what we're talking about. Again, we just happen to call them clinical hours. Other schools call them practice hours, immersion hours, but we want you out there getting your hands dirty in an organization that's going to help build you to the level of DNP expert. We want to teach you something that you ordinarily wouldn't know. Most nurses, we tend to be in our little world. I'm here at my clinic. I don't really get out very much. We want to push you out of the nest, get you out there, get you talking to people. What are we going to do to help develop your skills? And everybody's plan is going to look a little bit different. That's okay. That's the cool part about all this. So I hope that helps. I hope that alleviates some anxiety that you might have about the term clinical hours and preceptors. Again, not like you're used to in this kind of clinical setting. Let me know if you have any questions. I will be talking to you more about what we're going to do in class, but I just wanted to throw this video out there so that we're all jiving. But read over the DNP Essentials if you're not familiar with them. This may be the first class that you've taken at Eastern. Read over the AACN white paper and really focus on page 7 through 10 of that document, and I will attach these in the email that I'm going to send you. But again, Dr. Bradshaw, peace out. If you have any questions, please let me know.